Hi, this is Kia, and today I want to talk to you about temporomandibular joint syndrome. So TMJ for short is all of the pain that people experience when they clench, when they grind, when they have stress, and it can create so many problems like headaches and neck pain, even sometimes lockjaw. And a few exercises and some self-massage can really do a world of good. At our office, we do a ton of TMJ massages, and so today I want to give you something to supplement some of that so that you can take that home with you. So let's talk a little bit about what your TMJ is. It's a group of muscles around a joint called your temporomandibular joint. So it's right where your cheekbone kind of meets your jawbone, and if you open and close right in front of your ear, you can actually feel it. And what moves your jaw around is a whole group of muscles. The most important muscle, and the biggest muscle I would say, is your masseter. And that's this one here. So if you clench like you're chewing on something, you can feel it kind of activate here. And then there's two muscles on the inside called your pterygoid muscles. Now these are muscles that you're not really familiar with, but they're on the outside of the back of your teeth. That's called your lateral pterygoid. And then there's one right behind your teeth, kind of if you were to go all the way into the back of your molars, that's called your medial pterygoid. You also have what's called your SCM, your sternoclavicular mastoid, right? So again, mastoid, sterno, and clavicular. And so it actually comes up all the way here. And then you have something called your platysma, which is this whole group of muscles. Like when you do this, and it comes through here, but it comes up over your jaw. And then of course you have your temporalis, which are the muscles up here. And a lot of times when those are overused or tight, they become incredibly tight and sore and create some headaches. So let's get started with a couple of stretches and then we'll go into some self-massage. Okay, so we're gonna start further away from your temporomandibular joint, and that's going to prepare that area that's overused. So let's start with your SCM. So one of the easiest ways to do this is by taking the pads of your fingers, placing them on your collarbone here, and beginning to press down. You're gonna start to feel a stretch. Now this is for your SCM and your platysma. So you're gonna press kind of down towards the floor, and then you're just gonna look up. You're gonna feel a nice stretch through this whole area and down. And then replace your fingers and up and down. One more time, and this time you're going to jut your lower teeth over your upper teeth like this. Now I know that sounds crazy, but give it a try. It gives you such a good stretch. And teeth. Back down. And up. And back down. Now you're going to take your right hand and place it on your left collarbone, and you're going to start to stretch. Look to your right, and then look to your left. This gets your sternocleidomastoid. So this gets your left platysma and your left sternocleidomastoid. Do this a few times. Now you want to go to your end range of motion, so you're going to turn and really push over. You're not scrunching down, you're just twisting, keeping your chin at a parallel level. Coming back this way and pressing. This can help with some neck pain too. Let's try the other side. Pressing down, away from your head, really just towards the floor. You don't have to do any of this, just down. And first, you're going to go kind of toward your elbow, right? For your platysma. And then for your sternocleidomastoid. Again. And you just take your own time, breathe in and out, nice and relaxed. What's really cool about this is you can do this at your desk anytime you have neck pain or some stress. We all have that. Okay, so the next thing you want to do again is cross over, and you're going to start to try to find, there's like a little band of muscle right here. And I just want you to take it and begin to massage it. So this is your sternocleidomastoid. It might be hard for you to find, but it's tight on pretty much everyone. And even if you're just getting skin, this is going to be great. You don't want to go too deep, just nice and loose, and just start to kind of walk your hands up your neck. And you're going to find this. Now, if you notice, I start to turn my head to the side as I get closer to my jaw. And that's because as I turn this way, it shortens the sternocleidomastoid, so it's easier for me to get. If I turn this way, it lengthens it, and you can see here it's short, and there it's longer. So I keep it this way, and I just massage. You're welcome to do that as many times as you want. If you do want to extend any of these, just pause the video, and I'll come back to me when you're ready for the next step. So we'll start this way. And I'm just gently walking up. You're welcome to use a little bit of oil. I really love using a rice bran oil. You can also use a nice sesame. A sweet almond oil is lovely. So you're just gonna walk up. And now we're ready to get into our jaw. So you wanna think about, I'm just gonna stand to the side for a second. You wanna think about the mandible. It actually hooks around through here, and this is how you want to begin. So we just walked up the neck, and now we're going to drag down. Again, you're welcome to do this with oil or without. It's whatever you feel best with. So you're going to take your pointer and middle finger, and you're going to start behind your ear and in front of your ear, and you're going to start dragging down. I like to do it at the same time, but you can do it side to side if you want. It would just look like this. You can bend from side to side. But you want to do this several times. This feels incredible. You want to make sure that you come all the way down into your clavicle. So up, and this is nice and gentle. This also gives you a little bit of lymphatic drainage, which is always good for your face. You don't press too hard, you just want to press really gently. Remember, you have tons of fascia here, and these gentle strokes help to soften that fascia. You'll probably already feel a little bit of relief through your neck and maybe even through your jaw. So the next thing we're going to do is get into the masseter. So you're going to want to find your cheekbone and just go right underneath it. You're going to take all 4 of your fingers, bring them together, and start to go in little circles. Now the way that you want to do this is open and close and then clench. If you don't feel muscle moving, it just means you're on your teeth, okay? You want to bring here. So when you clench, you'll feel it. You can even see my fingers move, look. That's how strong my jaw is. And yours is too. So you're gonna come around, and then you're gonna start to drag in, come up, and start to drag down again. Now again, this isn't a really, really deep exercise, and all of the pads of my fingers are here, right? So this is what it looks like. If there's any area that feels awesome or sore, you know, you're like, oh yeah, I'm right there. Go ahead and hang out there. Like right here feels great to me. You don't want to go super deep here because these muscles are already really sore. And then you're going to take down into your chin. So again, if you want to hang out in that last massage, feel free to pause this, come back to it when you're ready. So next you're going to take your pointer fingers and your thumb, and you're going to just pinch your jaw. Pinch down at your chin. See? So it just kind of looks like that. And you're going to come around. So my thumbs don't really move, it's really my pointer fingers. Right? And you're just going to trace your jawbone all the way to the back. And this isn't pinching, it's not hard. It doesn't need to be hard. Right? And you want to do that 15 times maybe, whatever feels good to you. And then once you come to the front of your ears again, you're going to start to come up and down, up and down. So again, when you come over your cheekbone, you're going to be in your temporalis, and you're going to open, and then you're going to close, and you're going to clench. And you're going to feel the muscle that's working, okay? So once you find that muscle that activates when you clench, keep your fingers on it, all 4 of them, and start to circle, making circles forwards. And you can really, I like to look down when I do this. It just helps me relax my neck instead of pushing. Forward 10 times, and then backwards 10 times. Maybe taking a little yawn. Relaxing the belly. One of the things that's really great to work on here is diaphragmatic breath. If you don't know what that is, check out my video on diaphragmatic breathing. It's super helpful. And then forward again. And backwards again. Start to rake through your scalp. This is just really lovely. Feels awesome. If you have a scalp massager, use that now. And bringing it down. So these are some of the basics of a TMJ stretch and massage routine that you can do multiple times a day. You can do every day. We do have some more advanced techniques to get into those pterygoids, to get into some of your suboccipital lobes, which are also responsible for clenching your jaw. And you can check that out in our more advanced techniques video on TMJ release. My name is Kia, and thanks so much.